The patient advocate service was created really out of an escalating call volume and the need to find a solution for patients that did not necessarily need an ambulance and an emergency room.
In the past, when we'd respond, lights and sirens, we'd show up to these patients and we didn't really have a way to identify them before the incident happened. So we're kind of limited on what we can do. So we can basically put a Band-Aid on the problem. We can stabilize the patient and get them over to the hospital where they may get released and they still have the same issues. So we didn't fix the problem. Well, now with the data that we're collecting from the VA that's being sent over in the telemedicine program, we can identify these veterans and get to them long before that ever happens, which leaves our emergency response vehicles in service to respond to other emergencies, which means we get there quicker and we keep those resources available for fires or car accidents or any type of other emergency incident.
We use our data analytics to determine which veterans need it the most by doing something called predictive modeling. We use products that the VA has created known as Care Assessment Needs Scoring, and we determine those veterans based on the number of chronic diseases they've had, based on the number of ER visits or amount of primary care visits, basically amount of utilization needed. We'll determine who needs the care and we will pull the veteran to us.
The VA identifies our high-risk veterans in the city of Tempe, and they schedule an appointment directly with our patient advocate services. That unit is a Tahoe that's staffed with 2 nurses. So one nurse from Tempe Fire Medical Rescue and one nurse from Tempe St. Luke's, through a partnership that we have with them. And they make that appointment and they'll actually go visit the veteran in their home. So they'll go out and they'll actually link up through telemedicine, through a video conference and a live feed with a nurse practitioner from the VA.
The type of telemedicine that we use is a video conferencing platform that allows us to be able to see the nurse practitioner who's at the VA, and they are overseen by the patient's primary care physician. And so what we're able to do is actually bring the PCP or the MP to the patient via video conferencing. And so they're able to go through everything with their medications, and then that provider is able to do med refills and send them out to the patient by mail, so the patient doesn't have to be inconvenienced in any way by leaving their home, and they're still able to get the entire quality of care that they need.
And sometimes when you're really sick, you're going 2-3 times a week to different clinics. And me not having to travel, having these people come here, it's wonderful. It's just perfect.
I love the care I'm getting. And I think my wife's a little jealous of the care I'm getting. It's beautiful. And they get to spend more time with you, I think. It's hands-on. You feel a little more comfortable yourself, and therefore you're able to ask questions. This is well thought out. It's an excellent program.
The hardest thing for people with this is the travel. I can't drive because the drugs are in. You're always inconveniencing somebody. Plus, they act as a buffer. You got an independent people talking to that nurse at the VA, and it's a great comforting feeling to know, well, I got a backup here, And plus, another opinion is always good, and that helps a lot. I mean, when you're old, your mind isn't like a razor blade anymore, more like a marble.
We go in and we're able to assess their needs, and we're able to get the resources that they need. So sometimes when the patients do forget certain things, we're able to help them remember something as simple as follow-up visits. Sometimes these patients have to see numerous specialty physicians, and it's really hard for them to keep it all together. So what we do is we come out and help them, even if it's putting a big calendar for them and helping them to get organized with all of their follow-up care.
Healthcare is in the middle of a revolution, and what you have in this program is that you have all elements of healthcare revolution coming together to develop a program that is in place, is taking better care of veterans, and is going to continue to revolutionize the direction that the whole general healthcare community moves and how people are taken care of.
a lot of times as a paramedic in the field, when you respond through a 911 call, we are able to temporarily solve that patient's problem and then get them to an emergency room that stabilizes them and they go home. But we've been able, for the first time in my career here in Tempe, to actually make a significant difference on a patient's health and their long-term issues, and see them real time and build that rapport and interpersonal relationship in their home, and then watch them progress to become healthier, where they're not going to call 911. And to see that happen with our veteran population is exciting for me.
The best thing about it is it saves you so much time and energy. And got a way better feeling after they leave, you know, always. And feeling good and being positive about it's 3/4 of the battle with this stuff.
You just can't beat, you know, your nurse coming out pretty much and monitoring you. You're doing one-on-one pretty much. It's great.
You know, it really is a good program, and everybody's so kind, you know. So it's wonderful, and thank you, everybody. I really do appreciate it from the bottom of my heart.